position, something. So we were talking about the qualities that make you unique. Like in sales, they talk about what is your USP, unique selling proposition. So this is harder to focus more than our strengths, but reflect on this and provide examples. That's what we say. Then write about your ideal future and achieving goals. Include attributes, skills, and resources you have that will help to make this possible. This is where I said, like, your goals completely depend upon your self-esteem. People with low self-esteem, they set only moderate goals, whereas people with very high, healthy self-esteem, they in fact set great goals, achieve, and even when there are problems on their way, they're able to overcome that and do that because they know what are the skills they have, what are the resources they have, and more than the skill and resources, what are the attributes they have in order to make those goals possible. Probably it might take even a longer time, but take it as a homework and do it. Definitely. But think about it. Is your self-esteem restricting your goal? Like all of us have goals, but not in a very formal way. In fact, I even conduct sometimes 3 hour workshop on goals and goal setting and things like that. All of us have wishes, but not specific goals. And very rarely we formulate the goals and work towards them and identify what are all the obstacles on the way. It's almost a 12-step process. What are the help that we need and all that. So I don't know how many of you have done that in a very formal way, but just think about even your wishes or goals. How big or how small is it, and how it is related to your self-esteem? That's the only thing I wanted you to understand at this point. Then probably you can do it in a much slower way. So same thing repeated in a different way. Probably will take up questions from here. So thank you. Stop sharing. Okay.
Yeah, thank you, sir. We thoroughly enjoyed how to boost up our self-esteem. You beautifully explained with exercise. Yeah, friends, those who are having doubt, they can interact with sir. Yeah, Jyoti Makar.
Sir, thank you for the wonderful session. I wanted to ask that I have two sides of myself. Sometimes I'm very positive, optimistic, and I offer gratitude to Almighty for everything. And even if I'm facing some difficulty, I think it must be a blessing in the form of disguise. I try to take it that way. But sometimes I don't know what happens. I become very rarely this happens. I become very pessimistic and I become the most ungrateful person on this entire planet Earth. There are so many things I have to thank God for, but I forget everything. And I become very sad. And I think that what is the purpose of this life? Because mainly because I'm facing unemployment issues. And I start doubting that will I ever be able to stand on my feet or not and all that. And then another moment, again, I'm optimistic and think life is a gift of God. It's okay. And I change. So that aspect, that rare aspect of mine, how to eradicate it, how to
Okay.
remain optimistic and joyous all times. Whatsoever happens, it's okay. God is with me.
Okay. So this is what I said about unstable self-esteem and variable self-esteem, right? So it's not uniform, it's always high. If somebody can maintain the same high self-esteem 24/7, all 365 days for the rest of their life, they're made of steel. They're completely different people. So these fluctuations come, self-doubts do come. But whenever you get a self-doubt, then you just introspect and identify what's the learning experience from here, what exactly triggered this low. And then also recollect the times where when you were positive in your self-esteem and what were the components and how you can replicate that here. Have I given you an answer?
Yes, the other moment, I think that I apologize to God. When I think life is a gift of God, I say, sorry, God, forgive me. I became ungrateful. And then again, I restore to normal self and start functioning well.
Okay, probably like the self-esteem journal and the gratitude journal, all that together should work. Because when we keep thinking, it's very, very fluid. But when we put that into writing, it's really very, very concrete. So the moments where your self-esteem is really good, you reflect on that and write. So on the days when your self-esteem is low, you can go back and look into the writing where your self-esteem was high, and then probably you will be able to gain from that.
So I have made a gratitude journal in which I have offered gratitude for everything. Like I attended this 21 days workshop, like offering gratitude for my limbs and organs functioning well and everything. So I have thought that I should get up and daily
Yeah,
read it, especially on the days when I feel low. And then I
that's
should
right.
say thank you.
That's right. So, I mean, the one of the important things I would suggest is when you overdo certain things, it becomes a ritual. You lose the real meaning. Okay, when you read it daily, and at some point of time, you just miss the point out of there, and when it becomes a ritual, then the real effect of that particular exercise is lost. So don't allow any particular exercise or whatever you learn to become a ritual where you take the essence out of it. That's one of the important things I would suggest here.
Yeah. Thank you, Jyoti.
Thank you, sir.
Thank you. Dr.
Venugopal sir.
Venugopal Reddy here is there.
Okay. Srinivasanji, I
Yes,
appreciate you for choosing this topic, self-esteem, which is very relevant and important. And I would like to share some of my own thoughts if you give me the permission. Do you mind if I share my thoughts?
Not at all. It's Sunanda is the one who is
Okay, I won't take more than 1 minute
right.
because I talk about time management.
Yeah.
Now, high self-esteem, as you said, that ensures good mental health, no doubt about it. Look at the politicians. They rarely commit suicide. They rarely suffer from depression. Even if they fail, lose their deposit, because they have high self-esteem. That is my observation. I'm not saying that nobody commits suicide, but rarely. We take 1 million politicians, but many doctors, engineers, other people, they are not able to cope with life's stresses. They commit suicide. Yesterday, I gave a talk. The curiosity quotient, and some of these people who are here, they listen to my talk. People with a high intellectual curiosity quotient, they rarely get into any kind of mental health problems. When you asked what is my self-esteem, I put the number 100%. But my self-esteem was around 20% some 40 years back. Then how did it change? I empowered myself with life skills. That made a big difference. Thank you.
Thank you, sir.
Yeah.
In fact, about the politicians, I always used to say to my patients and other people, they go to jail, they are arrested under corruption cases, but they come as if they are like the freedom fighters. They lose an election, they win an election, that doesn't affect them much. So, I mean, as you rightly pointed out, we should be like the politicians in our life. I mean, not exactly what they are doing, but at least the confidence that they exude in every situation.
Resilience, you mean?
Yeah, very true, sir. We can learn confidence from them. Yeah, Shivraj Ramsamy.
Sorry, I have given a talk on politicians' mindset. It is available on the YouTube.
Yeah.
Politicians' mindset. If you find
Yes.
time, please
Okay.
watch that one.
Thank you.
Sure,
Thank you.
Thank you, sir. Shivraj, please go ahead.
Thanks sir, for this wonderful opportunity session. And so I can give some example based on so sir has presented me on book about self-esteem. So journaling and then positive visualization. So within within few months, I have seen an impact. Like previously, I also used to give I can speak in public in colleges and all. But now voluntarily I go to schools. I got opportunity to speak in schools, and I started to write a book. Actually, I'm going to publish in another 1 month. So I can see a change over there through if you do these actions, whatever sir has given now. So I can be an example. Like so I can see the change actually. So it was really helpful. So my question is like, sometimes actually I want to, others also has to understand the same way I am understanding, or like have to behave the same way how I want. So how to change that, or like how to I have to accept those people, right? So can you give some point around that?
No, no. I mean, one of my famous statement is that the only person you can change in this entire world is yourself. But if you change yourself, everything around you changes because your inner universe changes and the mindset of other people change. But when you try to change others, they don't change. But when you change yourself, then things around you change. You cannot change others. In fact, if I have any way of changing the other person, a husband comes, these are all the changes I want in my wife, and I can produce that, then my practice will be at a different level, which is not possible. So the only person who comes to me, I can tell you ways of how to change. You cannot change others. Understand that, accept, and over a period of time, slowly, when your intentions are good, other people will change. Okay. Thank you, Suraj, for coming and joining. In fact, there are a few people
Thanks.
whom I have given the
Yeah.
book written by me and Dr. Suresh and Dr. Pontimani brother, The Power of Self-Esteem. So I have formed a group, I have posted in that, and Suraj has come and joined from there.
Yeah.
Okay, sir. Okay.
Yeah.
Yeah, Gopal Agarwal.
Can I speak in Hindi?
I won't be able to understand. I think Sunanda has to translate.
Okay.
Yeah,
You
yeah,
cannot
please go
understand.
ahead.
मैम जैसा कि अभी मैम ने पूछा था कि मेरी सेल्फ एस्टीम लो हो जाती है, तो आई थिंक जैसे सर ने कहा था अभी, श्रीनिवासन सर ने, एक्सपेक्टेशन और एक्सेप्टेंस इज द ओनली वे टू सेटिस्फाई टू हाई द सेल्फ एस्टीम। जब हम किसी व्यक्ति, वस्तु, परिस्थिति, स्थिति को एज इट जो है जैसी है उसको एक्सेप्ट कर लेते हैं, उसी वे में एक्सेप्ट कर लेते हैं, तो हमको एक सेटिस्फेक्शन लेवल आ जाता है। ठीक है ना? इसका मतलब नहीं है सेटिस्फेक्शन का कि हम एफर्ट्स नहीं करें, एफर्टलेस हो जाएं, लेकिन हम उनसे ये करते हैं कि ठीक है जो है जैसी व्यवस्था है एक्सेप्ट कर लें, और एक्सेप्टेंस जो जैसा व्यक्ति है उसे एक्सेप्ट कर लें, और एक्सपेक्टेशन, कामनाओं को हम कम रखें, जैसे गीता में कहा गया है। तो जैसे ही हम अपनी इच्छाओं को कम करते जाएंगे तो सेटिस्फेक्शन आता चला जाएगा, और हमारी जो एस्टीम है वो हाई होती चली जाएगी एज पर माई व्यू। थैंक यू।
Thank you.
Thank you,
everyone.
sir. I got the answer. Thank you.
थैंक यू।
Yeah,
Pata ma'am.
Jyoti, you can translate to Srinivasan, sir. Dr.
Yeah,
Srinivasan.
yes, he said that if we accept the circumstances as they are, but we should not decline in making efforts. We should accept the circumstances and we should maintain equanimity amidst all circumstances, as it is mentioned in the Gita, Bhagavad Gita, that taking pleasure and pain as equal, taking friends, foes, everything as equal. So that is the way to remain calm and equipoised in all situations. That's what I understood. And I forget this when I develop low self-esteem. And thank you very much. I'll keep it in my mind.
Yeah, thank you, Jyoti.
Thank you.
Yeah, Partha, sir.
My gratitude to the Srinivasan sir is awesome. Just to add one for Jyoti ji, quoting Ma Sharoda, it's the easy way for anyone, for the ignorant to the vast learned. Self-esteem one can easily acquire by not finding fault in others. At any moment, you cannot say that, okay, I would accept from now onwards. It is not possible. Your I becomes the barrier. Always you start with I and end with I, and you become the endless loop. So don't find fault to the others is the first and the foremost lesson to anyone to start for self-esteem. That should be the culture inherited in our generations, not at the age or in a symposium to get in a audience or like that. It should be inherited from in our culture. Because I believe also all the think tanks present here believe that self-esteem is a culture spectrum. That's all. Thank you.
Okay, in fact, based on this, a friend of mine, Dr. Suresh, is doing a wonderful work in Chennai in schools, because we thought that if you have to prevent mental health problems, we have to probably inoculate them at a quite early age. So he has taken 8th and 9th standard, that is around age 13. That is the age at which probably you can teach these skills, and definitely that helps them in the long run to prevent problems later on, right from drug addiction to depression to suicide. I mean, in order to prevent suicide and drug addiction, this program was taken up, and the first research publication out of that has also come. Thank you.
Thank you, Partha, sir. Yeah, Archana Vedantam.
Sir, from the discussion, what I heard now, my understanding is by not getting affected by the environment, we can maintain that equanimity. That's Sthita Pragnata. In Telugu, we say Bhagavad Gita, stable mindedness. But to not get affected by the environmental triggers, what sir said is we should not focus on the results. We should only put efforts. That's what given in Bhagavad Gita. Anything else I need to... Anything am I missing, sir?
No. What you're getting is right. One of the aspects we talked, see, there's a very complex interaction. Like many people are saying, not get affected, but only people with high self-esteem will be not affected by this. People with low self-esteem will be affected by this. So to say that you don't get affected, so you will develop, that's a very, very simplistic way. So you have to probably work on your self-esteem in a holistic way, not exactly in one aspect, from multiple aspects. Then you will be able to reach a stage where you won't be affected by external events. But in order to not to get affected by external events itself, your self-esteem need to be high. So it's much more complex than a one-to-one relationship. That's all I wanted to say at this point of time.
Thank you. Thank you. Wonderful, sir. Thank you.
Thank you, Archana. Dinakara, sir.
Very good session, Dr. Srinivasan. And I was very particular to attend because I'm at the age of 79. And I said, this is going to be very, very important session. And I am also thankful to my Sunanda for arranging your talk. Very useful, very practical, wonderful talk. But actually require workshop. Not 1 hour or 45 minutes will not be sufficient for you. I think next time when you conduct the workshop, inform us, we will try to attend. Thank you very much for a wonderful talk.
Thank you, sir. Thank you. I'm blessed to have your appreciation.
Yeah. Thank you, sir. I think no other doubts. Shall we conclude today's session, sir, with your permission?
Okay, sure.
Yeah,
Yes.
Archana, please go ahead.
Yes, ma'am. I want to express my deepest gratitude to Dr. Srinivasan sir for his very enlightening session on self-esteem. Dr. Srinivasan sir's insights into the multifaceted nature of self-esteem and its profound impact on mental health have greatly enhanced our understanding. His explanation of the components of self-esteem, including the characteristics of inflated self-esteem, high self-esteem, low self-esteem, signs of low self-esteem, has empowered us to better understand and identify these traits within ourselves and also people around us. All the self-reflective questions and his emphasis on importance of resilience, openness to corrective criticism, and peaceful conflict resolution as indicators of high self-esteem have left us feeling more confident and capable. Dr. Srinivasan sir's articulate delivery and wealth of knowledge has left an memorable mark on all of us, and we are immensely grateful for the opportunity to benefit from his experience. Once again, thank you, Dr. Srinivasan sir, for your dedication to enhancing our understandings. Your impactful session will continue to inspire and guide us as we navigate our individual journeys towards self-improvement and holistic well-being. I also want to express my heartfelt thanks to all the participants and the organizing team for their unique contributions and meticulous planning, which have been the driving force behind success of today's session. I want to extend our gratitude to our esteemed partners, Yellow Pond India, Forest Creative Arts Studio, Punjab, Sridipti Counseling Center, Hyderabad, Clover Learning Center, Hyderabad, Srisha Counseling Center, Kozhikode, and Mind Style Hub, Kolkata for their valuable support and collaboration on behalf of Deccan Positive Mental Health. Thanks to all for your time and efforts. We look forward to seeing you at our next Friday's session. Your presence is highly valued. Thank you.
Thank you very much for that wonderful sum up. In fact, you have summed up the entire session in about 2-3 minutes. Excellent summing up. Thank you once again.
Thank you, sir. Thank you, friends.
Thank you,
Thank
sir.
you. Thank you.
Thank you, sir.
Thank you, sir.